My name is Dr. Andrew Croak. I'm a board-certified fellowship-trained urogynecologist, otherwise known as a specialist in female pelvic medicine and reconstructive surgery. I have been in private practice for 15 years in the Maumee, Perrysburg, Ohio area, and I'm proud to say that we have been independent and have a healthy, vibrant practice. Urogynecology deals not only with general gynecologic topics, but deals with problems that women experience, particularly in the peri or postmenopausal age range, including urinary and fecal incontinence, pelvic organ prolapse, irritative diseases of the bladder, vagina, and rectum, as well as sexual dysfunction. We often use medicinal and conservative therapies, as well as advanced surgical procedures. My surgical volume has excellent expertise and vast knowledge of robotic reconstructive surgery, as well as vaginal, minimally invasive surgeries. Although we stick to scientific evidence, we're very progressive in the technologies that we provide in order to offer our patients the best and latest treatments. Hello, this is Dr. Andrew Croak, and I will be talking about MonaLisa Touch in an educational seminar today. MonaLisa Touch is a vaginal health light-based postmenopausal treatment. The fact is that by 2025, over 1 billion women worldwide will be above the age of 50. Thus, many of these women may suffer from genitourinary syndrome of menopause, which includes a constellation of symptoms, including vaginal and vulvar dryness, itching, burning, discharge, painful intercourse, and lower urinary tract symptoms of urgency, frequency, or even dysuria. Some women may have 1, 2, or all of these symptoms that can be quite irritating and affect their quality of life. As a woman goes through menopause, as many as 3 out of 4 will suffer from these changes in their gynecologic health, but they don't have to. One can see as a woman goes from premenopause to early premenopause through the first year of postmenopause that symptoms linearly accelerate, so that by the time a woman gets into their 7th or 8th decade of life, pretty much 8 out of 10 of those women are going to have symptoms. Why do these symptoms occur? The vaginal tissues become thin and very fragile. Vaginal pH increases, thus leading to more infections, and vaginal secretions decrease, adding to irritation and dryness. There are many treatment options, including botanicals, non-estrogen lubricants, vaginal estrogens, SERMs or selective estrogen reuptake modulators, or fractional CO2 laser therapy solutions. Current costs of symptoms management are quite variable. We do use a lot of vaginal estrogen cream, in particular for women that are of low risk and wish to use a conservative therapy. But as I have gone through my practice over the past 15 years, we have seen the cost of an average tube of cream to increase from $40 for a 6-week tube up to now $370 on average. So it becomes quite expensive, and if you are postmenopausal and above 65 years of age, most insurers and Medicare will not cover the cost of the medicine. So these women have to endure their symptoms, unfortunately, without much recourse. So the whole idea with MonaLisa Touch is to become yourself again. And it is okay to talk about these problems in order to try and get better. Over 40% of 46 million women are likely suffering at any time with these constellation of GSM problems. MonaLisa is a non-surgical approach to vaginal health that has very robust clinically proven data that brings long-lasting relief. Overwhelmingly positive are the results, and they are immediate as well. Many patients in my practice have called it life-changing. The goal of this therapy is to reduce symptoms of vaginal dryness, to treat conditions such as itching and burning, and to address issues such as painful intercourse, or even lower urinary tract symptoms like urgency and frequency. There are women with dermatologic conditions like lichen sclerosis that produces a very scaly, itchy type of skin, where MonaLisa has shown profound improvement in symptoms reduction. So the reason why it's so important to talk about MonaLisa is because there's no side effects, no downtime, and we are seeing long-lasting results. What I can't stress enough is that MonaLisa is not laser vagination, which is a hot button topic in my field because this procedure is often purported to make a fallen bladder tighter or to make a lax vagina feel tighter for women that are done with childbearing. It may claim to improve tissue turgor and decrease cough, laugh, sneeze leakage, which is known as stress incontinence. Unfortunately, many of these procedures don't have the scientific chops that MonaLisa has. In fact, these procedures may be marketed to people that have no pelvic floor training whatsoever as far as administration of those particular technologies. The FDA has come out with a recent warning regarding all of these treatments that did include MonaLisa. Harvard University, Mayo Clinic, and other top institutions reiterated the fact that the FDA warning is prudent and that patients must be smart consumers about where they receive their treatment, and that they should only receive their treatment from physicians that are especially trained in pelvic floor health. This is a safe treatment. It's a simple treatment. It often involves 3 treatments of less than 5 minutes each. That is what has statistically gotten women to an 80 to 90% improvement rate. It is an in-office procedure. It may require minimal topical to no anesthesia, and thousands of women have been treated in the United States and in Europe since 2008. The therapy initially began in Belgium and Italy, and over 25,000 women at that time were treated before the therapy was brought to the United States. There have been numerous peer-reviewed publications coming from not only Italy, but now major centers in the United States with grant money and scientific grant money to help look and study MonaLisa therapy. The evidence is quite robust. Now, this video I'm going to play is from one of my mentors, Dr. Mickey Karam, who actually got me interested in this therapy because as a urogynecologist, we tend to struggle with estrogen cream, not only from the sake of expense, but some women are frightened or scared to take it because of controversy over proposed risk of breast cancer or blood clots. Women who have active breast cancer and blood clots may not even be able to take estrogen, so they tend to suffer in silence. He reached out to me because of my frustrations with coverage of estrogen cream. And once I did go away to treatment and study this laser and learn how to do it, I was profoundly impressed. And once we finished treating our first 30 patients at our office, I felt like we could really validate this laser for our patients and feel good about recommending it. because all these 30 patients, each of them had improvement in their symptoms.
A game changer is literally something that alters the way we do things. And we don't have a lot of game changers that come along every day in medicine. We constantly are trying to do things in a better way and in a more efficient way. I like to use the word game changer with this because it is fulfilling a huge void for women. This is almost immediate. As part of the protocol, we had patients, we would see them 1 week after their first treatment. And hands down, there was improved moisture, less pain, less pressure. This is very exciting to me as a researcher because I think this is just the tip of the iceberg. This area of vaginal and vulvar atrophy, which basically means the vaginal tissues become dry, they become very sensitive, is a huge problem. There's really not a lot of epidemiologic data, but millions and millions of women suffer from this. And unfortunately, most of them suffer in silence. So this is a very, very needed therapy. I was very willing to try this because it's a huge need. It's a huge therapeutic area. The other big group of women that are truly suffering in silence that can't even take the medicines are breast cancer survivors. I can just tell you that I am blown away with how well it works. The therapy takes somewhere in the range of 3 to 4 minutes to deliver. It doesn't require any anesthesia, no creams, no Valium before, nothing. There was not one patient that could not tolerate it. It's a probe that goes into the vaginal canal, and then you deliver the laser therapy. There's no pain with the laser therapy. Sometimes putting the probe in on that first therapy just because their vaginas are tight and sensitive is a little bit painful. But again, we did not have one patient that couldn't tolerate the therapy. Hands down, 100% of the patients have had improvement. It penetrates the wall of the vagina and stimulates cells that are important in creating fluid, improving collagen synthesis. It's a very, very scientifically validated mechanism of the way it works. So this is real. This is legitimate, and I'm very excited about it. This isn't about enhancing sex. This is about treating a medical condition that basically occurs in almost every woman that goes through menopause. So you would want to make sure that they're not being pulled into something that hasn't gone through the scientific validity and the due diligence required. I would say that if you've got these symptoms and you can get to a physician that is able to deliver this MonaLisa touch therapy to you, not too many things you can say there's no downside to it. I really don't see any downside and a tremendous potential upside.
So I thought that was a very powerful statement. And when I went away for training, many women would hold me by my elbow and say, I don't know where you are from, but please get this, it's changed my life. Women shared stories of being fired from their jobs because they were in discomfort, of being divorced because their partner was frustrated with their lack of intimacy, or even very emotional stories about how their oncologist saved their lives with their breast cancer. But unfortunately, the chemotherapy and the treatments for breast cancer made their vaginal health rather poor. Now, who is a candidate for MonaLisa Touch? Basically, patients with symptoms of menopause, and these may even be premenopausal women that are on long-term birth control pills or long-term breastfeeders, which both tend to have drier vaginas. Patients with a history of breast cancer, thrombophlebitis, or other contraindications to estrogen therapy, patients who cannot use estrogen, and premenopausal women who've had their ovaries removed for whatever reason. Contraindications, of course, any undiagnosed vaginal or cervical lesion, so we do like a pap smear on file. Active vaginal or vulvar infections. Many women, for example, may have herpes, but as long as they're on their antiviral before and after treatment, that is no issue. Pregnancy or 3 months postpartum or 3 months post-surgical, we would like those tissues to heal before MonaLisa touch. Prolapse beyond the hymen, so the fallen bladder or uterus that sticks out of the vaginal opening. A history of vaginal radiation to the vaginal or colorectal tissue. Obviously, we have to be careful about that, but we can often laser particular sides that are untreated. Most women with mesh kits, over 99%, will be doing well, but we do want to be careful about where we laser with a mesh kit. History of impaired wound healing or keloids. We don't tend to see keloids in the vagina, but if a woman is on long-term steroid therapy or has a tendency of hypertrophic scarring, we do want to have that discussion. These next few slides go over briefly some of the trials that show pretty astounding results. Yes, numbers are in the beginning small, but nonetheless statistically significant at over 90% improvement. This is another series of publications to look at improved sexual function, to look at microscopic biopsies of improvement after treatment. So in a nutshell, the MonaLisa has had global experience. The laser has been FDA approved for many other uses, from dermatology to orthopedic to neurosurgery, and it does have an application for CO2 laser, not only on the face, but if it is good on the face, it must be very safe for the vagina, and it in fact is. The first part of the laser is superficial ablation of the lining or the skin of the vagina. The second part is allows the laser energy to proceed and penetrate deeper, often 0.08 millimeters deep, to start the synthesis of new blood supply, new collagen, new glycogen growth. This will not penetrate vital organs or cause bleeding or infection. As you can see on these pictures, the laser is generated through a conical probe and deflected off of a glass piece 30 degrees to treat the vaginal sidewalls. The penetration is in a grid of about 37 microperforations that then allows the operator or the physician to rotate the probe at 60-degree intervals, starting at the top of the vagina and then extending down a centimeter at a time to treat the whole entire vagina and opening of the vagina. If there is ever such a thing as a quick doctor visit, this has the potential to do so. From pre-treatment to post-treatment, the experience may take as little as 20 minutes. Pre and post-treatment, a patient should refrain from anything in the vagina for about 48 hours. Patients most often can resume normal activities after that time, including bicycle riding, horseback riding, heavy exercise, or intercourse. Some of the results are pretty astounding. When you look at the before picture, there's a very thin epithelium or skin lining and not much lush tissue or supportive tissue underneath. After 2 months of treatment, we can see a large epithelial area with lush collagen, lush what we call hydration or glycogen deposition. It looks like a tsunami wave of healthy tissue. Histologically, the mucosa or the skin will be much better nourished and will have much better blood vessel infiltration. This brings in red blood cells, oxygen, glycogen, collagen. And all major symptoms of GSM are improved after the third session significantly. Now this next slide is a series of women. The first young lady is a breast cancer survivor and a district attorney. A lot to lose, nothing to gain, to promote this technology. And I think she has a very powerful statement.
I was diagnosed with breast cancer at 29. I had gone through 2 surgeries, radiation, was put on tamoxifen, and started experiencing all of the wonderful side effects of tamoxifen, which included vaginal dryness and atrophy.
Hot flashes and dryness and painful intercourse.
I was having a lot of pain with intercourse to the point where I just stopped being sexually active. We were having no sex at all, none. And, you know, it really was detrimental to the relationship because, you know, here you have your partner who is looking at you like, what is wrong with you? Or what is wrong with us? Is there a problem with, are you not attracted to me anymore? It's really hard not to be able to have, you know, sex with the person that you love. I tried multiple things. I did the patch, I did creams, I did oral medication, and I just stopped doing it because of all the controversy. This treatment is life-changing. It is something that you can do without feeling scared that it's going to make your breast cancer come back or cause other health side effects.
There's no drugs involved, so you don't have to be worried.
There's no pain, no discomfort, and I definitely saw results pretty much immediately. The treatment itself is totally painless. It just feels like a little bit of a vibration. After that first treatment, I had results almost immediately. I mean, within a few days, I could tell that things were functioning more as they should be.
Well, I would say I'm 90% better.
My message will be definitely try the MonaLisa. It works for me. I would recommend it to any woman who had any kind of concerns about vaginal dryness or atrophy. The improved intimacy definitely impacts a lot of aspects of my life. I'm happier, he's happier. I mean, I would say go for this because this will fix it.
So the take-home message is that this is a very simple and safe procedure, less than 5 minutes, no discomfort, no downtime. It's outpatient, virtually painless, no to minimal anesthesia, few side effects to no side effects. I've never had a vaginal bleeding, injury to organs, infection, ER visits, or chronic pain with this treatment in over 400 patients treated. And recent American Urogynecologic Society data showed that after 1 year, over 92% of women were still very happy with their treatment. Some women, up to 30%, may come back and do an annual touch-up treatment, just as they would for wrinkles on their face, to put it into perspective. They find that it's well worth their time, their effort, and their budget. With over 50,000 patients now treated worldwide, I think my patient sent me this card and said it best, that no, I said I've got acute angina, but we want people to have healthy vaginal health as well. This is my contact information and our website link. So the take-home message is it's okay to be yourself, to talk about it, and become yourself again. Now, as far as most common or most asked questions, people will ask, is this covered by insurance? And if not, what is the price for the treatment? Because there is not a J code, and because Medicare will not cover estrogen creams, and they tend not to cover erectile dysfunction medicines on the male side, that this unfortunately is not covered by Medicare or insurance. Some health savings accounts may cover this treatment, but in the slide that we showed earlier where estrogen cream can run up to $370 every 6 weeks, the price of the MonaLisa 3-treatment package ends up being lesser of a cost. Our charge is $2,100 for the 3-treatment package. This is a lot less expensive than what you would see in major cities or urban areas. And for those that listen to the webinar today, you will be receiving an opportunity for a coupon redemption for the treatment. In fact, we have many women that will fly in from New York, Florida, California, Texas, because the cost of the airline ticket, hotel room, and the price of the treatment is less expensive than what they would receive in their own local city. As far as, can this be used for cough, laugh, sneeze, or stress incontinence? No, this treatment is not meant for that, but it will help with urgency, frequency, or nocturia, which is getting up in the nighttime to use the restroom. We do see at least 60 to 80% improvement with this symptom alone. Does everyone have a great 100 to 90% improvement rate? No. Some women may only get 40 to 50% better, but out of those women, it's astounding to me that many of them will say, gosh, I still feel this is of great value and it was worth my time and effort because what I had to deal with before was miserable. And that's a very powerful statement. It can be used to help reduce urinary infections and vaginitis because as the treatment acidifies the vagina through better tissue turgor, glycogen growth, and moisturization, it thereby indirectly reduces infections. If you have any questions or other concerns or would like to see this video again, we will be posting a link and also a specific question and answer type email address where we will try and answer questions that you pose. Please do not pose any personal questions or questions that may require an emergent contact. Thank you, and I hope you've enjoyed this webinar, and we look forward to seeing you to help improve your health.